Okay, hello. My name is Shivona Rifle. I'm a nurse practitioner student at Brandman University. So this is my interactive therapy video. Uh, in this video, it's a 32-year-old woman who came to the office to see the psychiatrist. She stated she was sad, she was down, and she had no motivation in doing the things that she used to do before. All the symptoms admitted to major depressive disorder, but she denied suicidality, and a major trigger going on was that she found that her husband was in a relationship with another woman, which the husband attested to. It really hurt her. It made her feel depressed, and she lost the trust and confidence in the relationship, and obviously the husband's trust, and it's impacting now on her adjustment in the home. They're practically living as two separate adults in the home, and obviously impacting on her relationship with her children as well. She's home all day. She doesn't have any motivation to go out or do anything. There are no previous psychiatric history. This is her first major depressive episode. No previous hospitalization. On the social side, she has two young kids, age 6 and 8, in elementary school. She works as a school teacher, and she has been in her relationship with her husband. She says for the past, they've been together now for 10 years. She says she doesn't have any financial issues, no financial concerns. Medical history is negative, no acute medical problems. For the family history, there is no family history of a psychiatric disorder. Okay, and just moving on from there, she was then referred for after it was recommended the treatment after meeting with a psychiatrist. It was recommended that she undergo some therapy sessions to help her see how to help her with her depressive symptoms and see how she can function much better. So in this therapy video, I'm going to be blending three therapies. I'm going to be using the humanistic person-centered therapy, cognitive behavioral therapy, and interpersonal therapy. Humanistic therapy, it's a person-centered therapy. I'm going to be incorporating the elements of unconditional positive regard in this case, and in working with my patient. And why am I going to do that? Because it will enable me to show openness to my patient. It will enable my patient feel unique in her care, in her problem, and it will give her the opportunity to be able to open up and talk to me about how she really, about what's actually going on, and explore further. So, and for me, it will give me the opportunity to actually tap into her frame of reference, and we'll be able to talk about things and actually find some solution working together with my patient. And for the cognitive behavioral therapy, it's changing, will enable me to kind of help my patient change her negative beliefs or distorted thoughts. It is based on the premise that how the individual things affects how they feel and how they behave. My client in question has told me that, because of what has happened, she feels hurt. And obviously, because she feels hurt, it's stressing her out, and she feels angry at times. She feels angry in the home. So we're going to be working on with my client to actually reframe, reprogram her thinking, and perhaps it will make her feel less hurt, make her feel less pain, and obviously probably begin to build like a better relationship with the husband and with the family, and obviously see herself, make her feel positive about herself as well, and then focus on the goals that we have agreed. And the last one I'm going to be using will be the interpersonal therapy. And interpersonal therapy will enable me focus on her emotions and her interpersonal relationships, particularly her communication style or communication with her husband. And so it's appropriate in this case because it will enable her find ways to better communicate with her husband and with her children, and obviously engage in healthy communication that will actually not promote stress or reduce stress in the family. Okay, and that's basically it, what we're going to be talking about today. And I thank you for coming. And we just want to start by your name and date of birth, please. If you can just verify.
My date of birth is February 20th, 87. Name is Tanya Williams.
Okay. Thank you for coming again. And this session is going to be videoed. Can I have your consent for that?
Yes, you have my consent.
Okay. I just want you to tell me, this is a follow-up. Remember when we came before, we set up a treatment plan, and it included the goals. And one of the goals was that you were going to be able to go and do something, get out of the house, be able to do something for yourself, and find something that you do. And obviously, the other one was to be able to get your driver's license, kind of working towards achieving your independence. Is that still the case?
Well, they're definitely still my goal, but be honest, outside of today, I haven't been able to leave the house much. Besides help my kids get on the bus, I've not been motivated to even get dressed. Even though I do shower, as far as like getting dressed, I'll leave like my house clothes on. I would say I've probably lost about 2 or 3 pounds since last time you did see me. I'm not feeling motivated to eat much. I don't have much of an appetite. My husband is just gone, and I don't know where he's at. He's just sleeping around, and I just can't take it anymore. I just don't feel like he loves me. I don't feel like I look beautiful anymore. It's just something has to change. I don't know what it is. What do you think I should do?
It's okay to feel this way, and that's why you're here, for us to talk about it. But let's start by exploring some things. And what are some of the things that you have done or you like to do, and that will sort of bring you joy? Is there anything of some
things that I used to do?
Yeah.
To bring me joy? I definitely love cooking.
Okay.
I used to have Sunday dinners at my house.
Okay.
I would invite friends and family over to cook. I do like shopping. As far as like finding things for the house, exercising. I recently got a gym membership, but I just haven't had the motivation to go at the gym that I got a membership at. They have Aquafit there. I think Mondays and Wednesdays, so I know that would bring me some joy.
Yeah. Yes, I would encourage you because thinking about these things, and obviously going there, and when you go to the gym, it's obviously it brings you some joy, so it makes you feel a little better. And okay, it will make you feel a little better, and that will help. We came before, we set up a treatment plan, and it included the goals. And one of the goals was that you were going to be able to go and do something, get out of the house, be able to do something for yourself, and find something that you do. And obviously, the other one was to be able to get your driver's license, kind of working towards achieving your independence. Is that still the case?
Well, they're definitely still my goal, but be honest, outside of today, I haven't been able to leave the house much. Besides help my kids get on the bus, I've not been motivated to even get dressed. Even though I do shower, as far as like getting dressed, I'll leave like my house clothes on. I would say I've probably lost about 2 or 3 pounds since last time you did see me. I'm not feeling motivated to eat much. I don't have much of an appetite. My husband is just gone, and I don't know where he's at. He's just sleeping around, and I just can't take it anymore. I just don't feel like he loves me. I don't feel like I look beautiful anymore. It's just something has to change. I don't know what it is. What do you think I should do?
It's okay to feel this way, and that's why you're here for us to talk about it. But let's start by exploring some things. And what are some of the things that you have done or you like to do, and that will sort of bring you joy? Is there anything of some
things that I used to do?
Yeah.
To bring me joy? I definitely love cooking.
Okay.
I used to have Sunday dinners at my house.
Okay.
I would invite friends and family over to cook. I do like shopping. As far as like finding things for the house, exercising. I recently got a gym membership, but I just haven't had the motivation to go at the gym that I got a membership at. They have Aquafit there. I think Mondays and Wednesdays, so I know that would bring me some joy.
Yeah. Yes, I would encourage you because thinking about these things and obviously going there and when you go to the gym, it's obviously it brings you some joy, so it makes you feel a little better. And okay, it will make you feel a little better, and that will help as well with what we have talked about before, like making if you have the self-esteem issues, make you feel very positive about yourself, trying to get out of a stressful situation, obviously probably the house at the moment. So getting out a little bit more would help, rebuild some things, and so I would really encourage you, like say for example cooking, do it in maybe some, I don't know about with the children.
Yeah, maybe the kids like making chicken tenders, so we have they can help me like prepare that, and maybe this coming week I can take some time since they're out of school now.
Okay.
We can do that, and the gym does have a child care there, so I can bring them on those days.
Okay. So that will mean spending time with the children as well. And just tell me, when you spend time with the children, how does that really make you feel?
It really makes me feel happy. I try not to let them know like what's going on with me and their father, because you just don't want to get your kids too stressed out. But they do notice that their father is not home for dinner at times, or he's not there in the morning to kiss them goodbye in the mornings when they go to school. So when they ask me, where's daddy, I basically have to lie and say he's at work.
Okay. But at least it makes you feel happy, and obviously that's so you have said you're like you're distancing yourself away from them, so making you feel happy is like behaving more like my mom to them, and at least you're now more present for them,
right?
Which you wanted to, one of the goals you wanted us to achieve. So
right.
Maybe we should do all this and see how it works. And then the other one was about your driving as well. How is that going? Like getting the license?
Well, I still want to get it. With juggling the kids and juggling the fact that my husband hasn't been in his home as much as he should be.
Yes.
It has caused me to do more at the house for kids, for cleaning and everything. I really haven't had time to study, but I did download the manual online, and I plan on this weekend, since the kids is going to be with my mom, to study some. So
probably that will help with you being able. That's the first step. Being able to go out, and the confidence when you're able to do things like when you're going out with the kids, because I have maybe wanted to ask your husband. I understand there's a situation now, So obviously you'll be able to, as time goes on, you'll be able to do this yourself. And just tell me, I know you said he's in and out, but do you guys communicate at all when he's in the house?
Well, I don't know if you call it communicating, because he was just a liar, and when he talks, I feel like everything's a lie. So I end up just getting so mad and just screaming and cussing him out, and I know it's wrong, but I just can't tolerate it. I'm getting random calls from females and inboxes on Facebook telling me, you know, what he does to them, and it's just, this is too much. So I mean, I don't listen to him.
Okay, from what we talked before, I commend you for wanting to, probably you're still in the home, you're thinking, is that, correct me if I'm wrong, wanting to make this work. I acknowledge that, and I commend you for that. I know obviously the trust is obviously an issue now, and the pain that you feel at the moment. But I would encourage you that wherever he talks, if you can just try to listen, just try to listen, and just, I know it can be very stressful if you want it to talk, but just try to listen, take a deep breath. If you want to walk away, you can walk away. Okay, and so just tell me how you think everything is right now. How you feeling right now about the whole situation?
I mean, I definitely could try to just control myself as far as what I say and how I react to it.
Okay.
But I'm just gonna have to practice that. Maybe put me get out the house and going to the gym and spend more time with the kids and kind of having like a social life myself. Maybe that would reduce some tension that I have towards him. So I'm gonna try for the next 2 weeks not to argue, not to raise my voice.
Okay. All right. I really commend you for comments. So what we'll work on, just try and go out more. Just get out of the house, and it will help you focus on yourself. We're talking about focus on yourself and work on yourself, and just see, be positive about things and put out your positive image. And obviously with the kids as well, we'll do more work with the kids and see how things are in the next week. So I will see you next week. Is that okay? And
I have to work Thursday and Friday of next week, so anytime Monday and Wednesday.
Okay. So does Wednesday work for you? By the same time?